Good morning. Today our discussion is about the post-COVID condition. Post-COVID condition, most people who have COVID-19 fully recovered, but there is a current evidence that suggests 10 to 20% of these people experience variety of mid and long-term effect after they recover from their initial illness. Although our current understanding of the causes of post-COVID-19 are minimal and why some people are more affected, this is limited. This question and answer page will help understand about post-COVID-19 condition so you can make informed decision and help to protect yourself all year around. The post-COVID-19, known as long COVID, refers to long-term symptoms that people experience following COVID-19. Those people experience also symptoms might persist from their initial illness or develop after their recovery. They can come and go or relapse over time. The most common symptoms associated with post-COVID-19 condition include fatigue, breathlessness, cognitive dysfunction, for example, confusion, forgetfulness, lack of mental focus, or clarity. Post-COVID condition can affect person's ability to perform daily activities such as work or household chores. Anyone with the post-COVID condition, anyone can have this. Research suggests that approximately 10 to 20% of patients tend to develop prolonged symptoms associated with COVID-19. Current evidence does not allow us to confidently know who is likely to be more affected. Post-COVID condition is usually diagnosed by a healthcare provider at least 3 months after the initial infection. This 3 months period allows healthcare provider to rule out the usual recovery period from the acute illness. Sometimes this recovery period may be long, especially if someone is very sick. Symptoms can last for at least 2 months from when someone first falls illness. Symptoms of COVID condition can persist after the initial illness and even after recovery. Symptoms and effect can be explained when other conditions are ruled out. Symptoms also can change over time, although certain problems, for example, breathlessness, seem to be more common among those with more severe COVID, and it is more common with women. These symptoms vary between people, between adults and children. Overall, the most common symptoms include fatigue, shortness of breath, difficulty breathing, memory and concentration problems, sleep problem, persistent cough, chest pain, trouble speaking, muscle aches and pain, loss of smell or taste, depression or anxiety, and fever. People with post-COVID-19, also known as long COVID, may have difficulty functioning in everyday life. Their condition may affect their ability to perform daily activities such as work or household chores. What to do if this happened? If you have ongoing symptoms of COVID condition, seek help from your healthcare provider. They help you to determine the cause and provide you with care you need to manage the symptoms. At present, there are no proven drug treatment for the post-COVID condition. This is an area of active research. However, some commonly available medication can alleviate the symptom. There are data suggesting that holistic care can help a lot of patients regain their physical activity, cognitive and emotional function, and help to improve the quality of life. Anyone can develop the condition. Research suggests 10 to 20% they have the post-COVID condition and they have prolonged symptoms. Current evidence does not allow us to know confidently who is likely to be affected more than the other. Although certain problems like breathlessness seems to be more common among those with more severe initial condition. According to WHO, symptoms should last 2 months or more before the diagnosis is made. As we know that normal recovery takes long, it is important that other causes of ongoing symptoms should be considered. We cannot predict the condition will last for any given person. Most people experience improvement in their symptoms, but we know that lingering symptoms can last from weeks to months. Currently, it remains impossible to predict who is likely to have this problem. How to protect against it? Taking measures to avoid post-COVID condition is most effectively the way to protect yourself against it. This includes public health and social measures that reduces the chances of getting infection. To keep you and your family safe, remember to continue wash your hand regularly, keep distance from others, wear mask when it's a crowded, enclosed, poorly ventilated area, get vaccinated, stay up to date with the booster doses, practice respiratory etiquette, cough, sneezing into your bent elbow. The vaccine ability to prevent post-COVID condition depends on its ability to prevent initial infection to start with. The vaccine we use today are aimed to prevent the severe disease and death from COVID. However, some people still get infected despite the vaccination. The WHO expert group include patients, healthcare worker, researcher, has been considering the impact of the post-COVID condition on children and adolescents. Finding this report can be found here. 3 webinars available. What I mean by here is on WHO website. 3 webinars are available. For more information, go to post-COVID-19, children and young person. Young children with COVID-19 mainly present respiratory symptoms and are more likely to seek long-term medical care for persistent cough. Children with post-COVID condition are more likely to have fatigue, altered smell, and anxiety than healthy children. That concludes our presentation today. You can tell that this condition is still controversial and there is no particular treatment for it. And I meant by this presentation to shed light on the possibility of this presence of this condition in those patients who had the COVID but continue to feel sick. I hope you enjoyed this presentation as much as I enjoyed researching for it. Have a great day.